As I listen today, I appreciate the passion of all the witnesses here today. It makes me think of my wife as a family nurse practitioner, and her boss, Dr. Lisa David, is the chair there at Wake Forest Baptist Medical Center, and they work with infants with and children with cleft palates and do great work, so quick shout out to them and their work. Ms. Stewart, you mentioned the increase in the nation's preterm birth rate to 10%. And I'm sad to say, maybe this picks up with Dr. Adams there, our home state of North Carolina even has a higher rate, a 10.4%, and I believe a D rating. In the March of Dimes report card, I believe is where that was listed. What would you say attributed to the shift in the preterm birth rate after a decade of decline?
So unfortunately, we don't know all the answers of why the preterm birth rate has increased. What we know is that, in general, health outcomes for moms and babies have generally declined in this country over the past many years. And there are a various number of reasons for it. First of all, I'll just let you know that March of Dimes has 6 prematurity research centers, 5 in this country, 1 in the UK, all working together to try to look at some of the underlying causes, biological reasons why some of this is happening. But we also know that the impact of the way women and families, women especially, live in this country could also have a serious impact. So the degree of stress on women, especially before pregnancy and after, during pregnancy and even after. We also know that the lack of access to care. We have too many women living in places where, even if they have coverage, they may not have care. And there's 2 different things. So we have, even in a state like North Carolina, places, counties that are considered maternal care deserts, where women are not able to access the kind of prenatal care that they need in order to have a successful pregnancy. So there are a variety of reasons for it.
You and certainly my wife would know more than I, but I believe preterm or premature birth is defined as before 37 weeks. Is that correct? Yes. It is the #1 cause of infant death in the United States, with an average of 275 babies being born preterm per week. I know it is in North Carolina. What challenges or complications can infants face who are born preterm, and what challenges do their mothers face as well?
Well, either I can talk about it or Dr. Joy Perry can, because she has personal experience with it. But we work on this issue as a primary issue for the March of Dimes, as I mentioned. 380,000 babies born every year prematurely, again, before 37 weeks of gestation. What we know is that a lot of those preterm births are happening in the period between 34 and 36 weeks, so very late preterm. But some of the most devastating effects happen for a baby like Dr. Perry's baby, born at a very early preterm stage, so at 21 weeks or 23 weeks of gestation. And for those babies, the effects can be devastating. Babies can have developmental delays, cognitive delays, physical disabilities, and a whole range of lifelong health complications that are very expensive to address. One of the things that the March Times did is we updated a study on the cost of preterm birth. About over a decade ago, we looked at it at a cost of $26 billion in this country. It's now well over $30 billion. So it has a significant cost on the country from a productivity standpoint, as well as families and those children individually.
Thank you. Certainly I'm someone that believes that life is precious, whatever term that it might be in. I know that's not our discussion today, but any kind of biases before or after something is important to me. And I know, Dr. Perry, that's kind of your kind of specialty area, if it is. And someone who tries to advocate for all people, I would be concerned about that. So you're telling me that you see biases in there. I'm going to take that at face value, but I also want to ask you, on those biases, do you believe they're intended? Is it out of ignorance? Is it out of unintentional? Can you break that? I've got a minute left. I'm going to skip my final question because I want to hear from you on that as well, because that's important to me. Thank you.
They're definitely not intended. They're definitely things that we all kind of grew up believing. I was taught in medical school by my professors that there were 3 races: Mongoloid, Caucasoid, and Negroid. That was what I was taught. So I believed that the reason that I had a baby preterm is because I was Black, because there was something innately. So that's a bias that we've been teaching that we have to undo, that we have to retrain. My grandmother would say we have to unlearn us, right? We've learned some things that are incorrect. And so it's an opportunity for us to really, we're all the same. There's no difference between you and I. Our biology is the same. And so how do we then think about what are we doing as a country to ensure that we have both good outcomes? That's it.
Thank you, Dr. Perry. Appreciate your passion in that area. With that, yield back to Madam Chair.